Hello and welcome to the Digital Health Hubcast, where technology and healthcare collide. I'm your host, Hannah Clemmens, from the South Yorkshire Digital Health Hub, where we're on a mission to tackle health inequalities by transforming the future of digital health. Digital innovation is at the heart of the future of healthcare, and on this podcast I sit down with leading experts and innovators from across the digital health landscape to discuss the biggest opportunities, toughest challenges, and how we can innovate in this space to create a healthier and more connected future. In this episode, I'm joined by Kate O'Sullivan, who talks to us about how health data is kept secure in the UK. Kate is Head of Secure Data Services at the University of Sheffield and Associate Director of the Yorkshire and Humber Secure Data Environment. At the University of Sheffield, she's responsible for the delivery of the university's Secure Data Services platform, as well as the Data Connect service, which supports researcher access to routinely collected health data for public benefit research. Kate, welcome. It's so lovely to see you. How are you doing today?
Yeah, it's really nice to be here. Thank you so much.
And thanks for making the trip down. You've just been telling me about your house in lovely Scotland.
Yeah, no, we're really lucky to stay in Scotland, but also to work at the University of Sheffield and part of the Yorkshire and Humber Secure Data Environment. It's great. It's kind of proves the power of digital innovation. So.
Yeah. And it's not a bad place in Yorkshire.
No, exactly. I have the best of both worlds.
Amazing. So, Kate, a little bit more about yourself. You began your career as a historian studying medieval literature, culture and history. How do you find yourself now, Head of Secure Data Services?
Yeah, so it's been a very interesting kind of career pathway, but I think there are lots of... So I think when you kind of study old things where there's nobody there to interpret and there's nobody there to kind of say, oh no, this is what it is. I love like that kind of problem solving. And I love those kinds of like complex things. And I think that when you start to think about the world in these kind of complex ways, you develop kind of critical thinking skills, but you're also not afraid to ask questions and ask what seems to you is like an obvious question. But for people that are subject matter experts, sometimes they make lots of assumptions because they are experts and they don't realize some of the assumptions that they've made. So I think I kind of moved from a medievalist to doing kind of quality assurance, and I was lecturing at a university, but business students around culture. And then I moved into, like this area of quality assurance and thinking about bigger systems. And then as part of that, moved into kind of thinking about how we make decisions and how we can evidence the decisions we make. So very kind of data driven. So realizing that actually data can give you really great insight as long as you also can question the data. So I moved into kind of roles where I was doing more project management of complex systems that held data. And then was really fortunate to move into a kind of operational delivery project management role of one of the safe havens in Scotland. Scotland has a long history of sensitive data research. The Scottish government in the early noughties kind of made public policy like having secure data environments for research. So I managed one of the Scotland safe havens where researchers access sensitive data for research, but also then started to get involved in kind of research around openness and transparency around sensitive data. So how do you make research and research publications using sensitive data that can't actually be released? How do you make that more open and transparent, both for research purposes, but also for the public so that they understand how their data is being used? Then, yes, moved to the University of Sheffield, managing the secure data services, so our secure data environment at the University of Sheffield, as well as the Data Connect team, which is a service that provides access to the sensitive health and social care data for researchers within that kind of secure data environment. And then came on to the Yorkshire and Humber secure data environment. So that's part of NHS England. And the NHS England's position is actually, again, very similar to that of Scotland, Wales, Northern Ireland, where data for research should be in these secure environments, because that's important for public privacy, confidentiality, and kind of giving a lot of the controls around the public's data for research where there is demonstrable kind of public benefit from that research, but recognizing the rights and autonomy of citizens in actually contributing that data for that research. So we have a duty of care to the public to keep their data safe and secure. And one of the best ways we can do it is kind of via these technical systems and processes that ensure all of that.
Wow, there's so many parallels then between being a medievalist and working in data.
Weirdly, yeah. I mean, it comes down to that critical thinking, and it's kind of saying, well, like, what is this assumption? Why is that right? So I think historically there's been this perspective around kind of data where people have obtained consent from their participants in studies, right? They've gone out, they said, we're going to do this kind of research. Do you consent to being a part of this study? And then there hasn't been a lot of, it's kind of like, oh, yes, that research is legitimate. It's in the public interest. Go ahead and do what you want with it. But actually we have, again, even though somebody's consented to have that data, I think the question now is, don't we have a duty of care to those people? Like they're giving us their information, and it's our responsibility to keep that data safe and secure. And I think that, researchers know this. Organizations that support researchers, so sponsor these projects like universities or even the NHS, know this. But there was the assumption that everybody kind of knew how to do it, even though they might not have. And so there is this kind of parallel world that sits alongside the research and innovation side of things to kind of say, actually, this is how you manage data, and this is how you inform people how their data will be stored and managed, and this is how you inform the public of how the data will be collected, and if the project finishes, how it will be archived, and then how it will be deleted, and I think it's a really kind of, it's a very complex system, and that's what I like. I like this kind of complexity and thinking about things, and also kind of asking certain questions of and kind of challenging assumptions around to this. Yeah. So yeah.
So when you're talking about data gathered either for research or health data that's routinely collected, we're talking about things that are sensitive. We're talking about things that people, if they're in a research study, like you said, they will have consented. But can you tell me a bit more about the unconsented data that is held? Yeah,
so I think maybe the bigger context is the fact that there is a very robust legal framework for how we process data, any kind of personal data. So any data about an individual that can identify an individual. So there's the general data protection regulations, and then in the UK specifically, there's the UK Data Protection Act. And effectively it says that personal data must be maintained in the highest security. People need to understand how their data is being processed and what it's being used for. And again, so consented studies are you go via a very rigorous ethical review process, which is that you need to have ethics. So your ethics are on the basis of public benefit. So you have to demonstrate why that research will benefit the wider public. And then you also have to get you go through this informed consent process where you have to agree to how your data is being used and managed. Separately, though, when you visit your GP or when you go to the hospital to have scans or tests done, all of that data is collected in hospital systems and then held within NHS trusts, and then also in the integrated care boards, which help planning and evaluation of services within the NHS. all of that data is collected for clinical use. So for your doctor or your specialist to help your care. But researchers realized, and actually like NHS organizations that help do planning and service evaluation realized that actually that data is hugely rich for research. So where you can actually look at whole populations. So you can apply for ethical permission to get access to that routinely collected data for this secondary use of research. And again, it has to go via very rigorous, dare I say, almost even more rigorous requirements to demonstrate that public benefit, because people haven't necessarily explicitly stated that they are willing to have their data used for research. So you go via a separate kind of ethics process or a kind of parallel ethics process, and you have to demonstrate the public benefit, and then that data can be used for this secondary research, secondary research in the public benefit. What additional requirements there are for people that handle this data or process this data. And so what I mean by processing is extracting the data from those patient systems. They then have to go through a very kind of, a really kind of intricate process of de-identifying that data. So NHS numbers, for instance, get stripped out and are replaced with a special project-specific ID. First names, last names are removed, addresses are removed. Things like dates of birth are minimized to, say, a month of birth, month and year of birth, or we only release age, for example. And things like postcodes are replaced with something like an urban-rural code, or what's called like an index of multiple deprivation, which kind of changes a postcode into regional, kind of, it puts a person in a region rather than saying, this is where I live on this street. And we do that with all sorts of fields. So we might code data that has to do with specific protected characteristics. So aside from just your personal data being needed to be stored, we also have to do extra care around rare diseases or special disease categories, or things like ethnicity or nationality, which could imply a kind of special status. And so we have to do all of this work to support, to provide this kind of routinely collected data for research. And so again, this is all part of that secure data environment and the kind of the special places where this data can be, can actually stay in and can't leave. And that's, again, all to really kind of support the public and their privacy and confidentiality. And it's a kind of, it's that duty of care to protect patients and the public from their information ever leaving the secure environment, and but also a kind of recognition of their contribution to these research studies.
So a secure data environment, then, from what I understand, it's essentially a place where the data is de-identified, just as you've beautifully described, that researchers can then apply to, go into, analyse in whatever way they want. And all that can leave that secure data environment is aggregate data, for example, so the results of that analysis.
Yep, that's exactly right. Yeah, so it's known as the 5 safes principles, and effectively which are kind of a series. It's a framework for how you protect patient data. So it's safe people, so only researchers that are named on that ethics application. It's safe projects, so those projects have been through that ethical review process and have met all of the legal and ethical requirements necessary for research in the public benefit. It's safe projects, so when the data is is only accessed within a specific area of that secure data environment. Nobody else can access that. So there will be multiple projects in there, but no, if you're not named on 2 projects, you can only access the project that you're named on. It's safe data. So safe data is, again, that process of pseudonymization, et cetera, of all of the information. And safe outputs. So again, it's where, so it would never be like a row. If you think about like an Microsoft Excel document where there's a specific row of information, which could be related to a specific person or a hospital episode where, so it could be like hospital admission. None of that row level information leaves the environment. It's all aggregated into counts of 5 or 10. So again, that's another mechanism that we use to kind of make sure that when the kind of results of the researcher's analysis, so they kind of use that row level data to do all of like the complex kind of statistical analyses that they are, that they undertake to do their research, that the specific row information doesn't leave. Yeah, so again, it's the 5 safes are very much the kind of framework that secure data environments work to. There's additional controls also sort of that many secure environments go through. NHS England, for example, via the Secure Data Environment Network. So this is a network of secure data environments across England, require ISO 27001, which is an international standard for information management and information security, and you are independently audited on that. They require what's called the NHS Digital Security Protection Toolkit. So again, that is to assess how secure you are against NHS policies and guidance around information security and information management. And then there's, they've just introduced an accreditation process for secure data environments. So again, it's very specific to the NHS England Research and Development Program. So all of these secure data environments are like very, very rigorously controlled and monitored, again, to make sure that we do things properly.
Yeah. I'm picturing it like an impenetrable fortress, like something.
So it's all
really
virtual, which is really interesting. I mean, I mean, that would be the kind of, and that's how it used to be, right? So the Office for National Statistics still have what's called safe pods. So they have them throughout the country, and you physically have to go to this, and they're literally pods, and you physically have to go, and you can only access certain things via a specific terminal. That's obviously problematic, and especially where you have research teams that are made up of people from across many, many institutions, for example, you need to create it virtually. So it's all done. But again, it's either on NHS networks or it's approved delivery partners of NHS. So that's where there's a partnership, for example, between, say, a university like the University of Sheffield and the Secure Data Environment Network, where part of the university's responsibility as being a partner is to deliver and meet those standards for that accreditation.
That makes sense. I was thinking, if I was an innovator, for example, wanting to collect people's data to use through an app or a wearable or something like that, how easy is it for me to get into a secure data environment so that data is kind of kept really safe? Or is that something that an innovator has to work out for themselves? So
I think that's a really good question. And I think we have to think about innovators in different ways, right? So if you are a researcher at a university, for example, universities are effectively set up to do this and will have robust research governance support teams or additional support teams like one of my Data Connect team, for example, that will assist researchers via in scoping out the project, helping them with their ethical applications, because again, we need to provide a lot of information around the kind of data management side of things and the data security side of things, and we actually will prepare in some way, shape, or form, or liaise to get some data from the NHS and bring it in and then prepare it for researchers. And so universities have been doing this for a very long time, longer than, for example, the Secure Data Environment Network, which was kind of formally established by the NHS in 2022. So I think that's a really nice feature, for example, of the Yorkshire and Humber secure data environment, where there's been this recognition that actually universities have a lot of expertise in this and already have secure data environments that do exactly what the NHS wants it to do. And so again, it's this kind of recognized partnership. So an innovator within a university has access to be able to do this. University researchers will oftentimes have links to kind of commercial companies that are also innovating. So wearables is a perfect example of that, where the NHS doesn't produce wearables devices, right? It's other manufacturers that produce that. And researchers can work with those companies. The researcher will be the principal investigator. They will drive the research project. The university sponsors that project, so it has a legal obligation to make sure that the project is delivered to that public benefit and that the ethical requirements. But the secure data environments can be set up in such a way that researchers from both the kind of commercial organization and the university can see the data and work together on that. Mm-hmm. So this is absolutely very, very doable. But I think, again, those kind of public-private partnerships really are really the thing that is driving a lot of innovation, for example, within the NHS, but also, via universities as well. And it's partly because it is, again, it's kind of coming at it from many different ways. The manufacturers of those devices have research teams that are doing research, but haven't necessarily been recognized for that research in the same way that university researchers are. And so this is that kind of ability to kind of to do this research and this innovation, but in this ethical way, I think is another kind of security for the public, that their data isn't, being subsumed in some kind of, in a way that isn't appropriate, for example.
Yeah. Because I come back to something I've said a couple of times on the podcast before, is about, the terms and conditions when you get a new smartwatch, for example. You just scroll past them and think, yeah, just accept. Is that something that's in there about how your data will be stored and
Absolutely.
processed?
So if it is a consented study, for example, when you apply for ethical permissions, you have to state not only what you are doing for your project, but any other terms and conditions. And you have to make that accessible, so it needs to be in plain language. It needs to be simple. And again, informed consent. So that is where the public is it's in plain language. It's not technical. It's not like some of the things that you have, if you have tried to read them, things that don't make any sense, or you have to be basically a legal expert to understand. You absolutely have to go through this dual process of explaining all of those complicated T's and C's in an easily accessible way, so that people know if there is a dual purpose there, that the commercial company might process it in this way, but the research study is doing it in that way. And that people have the ability to pick and choose what it is that they want to participate in. So somebody might be perfectly okay with their wearables device being used in research around heart disease, for example, but maybe not something like mental illness, for example. And researchers have to, give the public that kind of ability to opt in and opt out.
Yeah. That's it's quite reassuring to hear. I think there's always a part of me that worries when I just consent to anything. What's actually going to happen? Am I going to find, weird emails in my inbox? Like, what's
Yeah, no, and I think that's right. And then again, this research, that we're talking about that would happen in that secure data environment, there is an absolute duty of care around that. Again, whether it's consented data or whether it's unconsented data, but again, the ethics around this, it has to go to independent ethics review panels. They are NHS. If you want to use NHS data, for example, you want to link your wearables data, so your smartwatch data, to other health records, you have to go via NHS ethics, and they will assess whether the research meets that public benefit threshold. And it is a long process. I mean, it's a complaint of researchers that the ethics process can take a long time. But again, we have to be mindful of the people that are, we are using individuals' data. They're using my data. I have a smartwatch on right now, I live by all of the data that my smartwatch collects, and they have to do the same thing for you. And I think that this is the thing that we do a lot of work with the public on, is to try and convey the security, the information security, the information governance, the rigor around ethics, and again, all these environments that we set up to also provide all of those assurances and safeguards.
Yeah, so no companies getting their hands on my NHS data.
Absolutely not. No. Again, a company may be able to see the data for research if they are collaborating with the NHS or with a researcher. But for example, we will not, if a company came to us at Sheffield, we are not in a position to be able to sponsor that research. Mm-hmm. So, and no, they can't just come and get it.
It's reassuring to hear. Yeah.
I mean, again, if a company is partnered with the NHS, they will have to go through very lengthy, and the NHS does, the NHS works with private companies all the time. Manufacturers of medical devices are private companies. So if you go in for an MRI or a CT or an X-ray, the machines are made by companies, but they have to go through very rigorous processes to become partners with the NHS, and they will see some of the data to evaluate whether those machines are working properly. Just like a researcher, interested in wearables and how that links to health data might see project-specific data. But again, that project, all of that data will have been minimized in such a way that it's never going to be a person that they will be able to identify.
Mm-hmm. I wonder if you can think of a time where security has been compromised in terms of health data for whatever reason. I suppose what the implications of that were.
So I think that there are differences between, for example, data breaches and security incidents. And, unfortunately, data breaches happen, and they happen, we will see them in the newspaper, right, where there has been a hacker or things like that. Interestingly, in secure data environments, there just hasn't been, because of such rigor and such kind of security around the access controls. So I probably should have said, kind of with secure data environments, most of them are so locked down, there's no internet, etc. There's no print screen capacity. There is no way to actually remove that data, except, again, the analysis outputs that each one of those will be reviewed by an actual human before they leave the environment. So there's virtually no way for somebody to penetrate them, because there's no internet for somebody to get into it. So I'm sure that there will be somebody out there, that will be very interested in this, but this heightened layer of additional security just means that thinking about secure data environments across the UK. So there are many that have been up and running since the early 2000s, for example, and have again been, are continuously updating their security protocols and continuously reviewing. Again, I mentioned these accreditation processes. When they're not easy to get through, a standard ISO 27001 audit, it's on a 3-year basis that you do a full audit, and then in the 2 years between your full audit, you do a mini audit. So again, you're constantly doing auditing, and you're constantly evaluating for security risks or just processes that need to be changed. I have an example of something that was deemed a security incident, but not a data breach, where in an environment we hadn't realized that a researcher was had managed to figure out, or had managed to default save some project specific data on just on like on their C drive. So if you're thinking about your laptop, it will come up and it will just say Windows C : and you probably never go in there and don't do anything with it. But a researcher had saved one file, for example, on a C drive, which meant that anybody else who had access to that C drive might have seen that file. We were doing nightly scans in that environment, so we caught it right away. Our systems administrator caught it. They notified us. We reviewed what it was, and it was analysis, so it wasn't row level. It was aggregated, but we reported it immediately to the NHS. We reported it to our data protection officer, but it didn't actually leave the environment. So that was considered a kind of security incident and deviation of practice, because the researcher should not have saved it there. But then we were able to put in additional technical controls. So we were already doing those scans to make sure that things weren't saved in proper places. What we did was we put in an automatic deletion script. So every night at midnight, anything that could potentially be saved in an improper location would automatically be deleted by the whole system. And so that's what I'm kind of talking about around these security processes. And again, in some ways you want people to do things that you hadn't predicted, right? So again, coming back to that subject matter expert thing, you make assumptions like, oh, we tell researchers not to save data outside their project, folders or their project workspaces. And, we go through this lengthy onboarding process and somebody managed to do it. Actually, in some ways, that's really good for us because we made the assumption that they just wouldn't do it. Another sort of like weird one. And again, how do you control for this? We had a researcher who knew that they couldn't print screen, who knew that they obviously couldn't remove data from the environment, but physically wrote some numbers down on a piece of paper and then emailed us asking it to bring it in because they wanted to format it in a slightly different way. And again, that physical writing down was a security incident because they're not supposed to bring data out of the environment. And when you do anything virtually, that is possible, right? But again, it was, so we obviously, kind of went, we reported it again, our NHS and the university data protection officer both agreed that it was a security incident, but not a data breach, in that literally the researcher confirmed that they had shredded the piece of paper that they had written it down on. They felt terrible, again, this isn't nefarious. It was just a silly mistake. Yeah. And we removed their access. We went through all of the instructions again. They sign an investigator declaration saying they won't do things. So we went through all of that. They re-signed it, etc. But what we also did was introduce a kind of weekly newsletter to all of our researchers. And what we started doing was reporting any kind of deviations of practice. So in that week's one, it was like, remember, even writing some numbers down on a notepad is removing data, which you are not permitted to do. So it's thinking about, if something happens, how do you mitigate against it? You can't, there is never 100% risk mitigation. Nothing is ever without risk, but how do you minimize that risk? And so one of the ways was, again, just around this proactive kind of reminding researchers on a weekly basis. So we used to just report which incidents had happened, if there were any, we could go months without a single thing happening. But like I said, some of that is good when people kind of do something that you didn't predict or you didn't expect, because then you think, okay, actually, how do we fix this? How do we stop this? Or how do we minimize it in the future or how do we try and prevent it from happening in the future?
Yeah. So trying to mitigate against all those human errors that.
Absolutely. Yeah. And, again, people that work in the environments make mistakes. You might press a button and accidentally do something. So then what you have are your standard operating procedures to recall that, and so again, these are all written down, everyone follows them, etc. But you always have, and you try and identify processes to make sure that if something like that happens, again, you have a written protocol to follow. And so, there's never a day where you're just like, everything's good. It's you're always thinking about, okay, what if somebody does this, or what if they do that? How do we mitigate against, and how do we put patients first? Yeah. So
always trying to stay one step ahead.
Absolutely. Even of your own errors.
Yeah.
So. Yeah.
Fantastic. Oh, Kate, it's been such a pleasure to speak to you today about data security. I've certainly learned loads.
I know I think people think it's a really dull topic in the sense of, it's just people sitting behind screens, but it's most of the people that are thinking about this aren't sitting behind screens. They're actually like doing things, like they're actually doing the doing. And I think it's probably just worthwhile saying, like, most of us all of us that do this are incredibly passionate. We're incredibly passionate about supporting research, but we're equally passionate about making sure that the people whose data we are responsible for, are protected, are safe, but actually we can use the information in their health records and in their wearables devices, etc., to actually improve health and improve well-being. And we are really passionate about this, and we're really committed to it. We're not frontline NHS, but we're actually doing other really fascinating things. And, it is incredibly rewarding to think about the fact that on a daily basis, the things that I do and that I think about and the decisions that I make contribute in some small way to all of that. So.
Yeah. Oh, that's wonderful. Kate, thanks so much for sharing.
Thank you.
Where can people find out more about your work?
So we have the Yorkshire and Humber Secure Data Environment website, which I'll provide that to you. Maybe you can pop it. You can find more about the University of Sheffield Data Connect service via the University of Sheffield website. And again, the Yorkshire and Humber Secure Data Environment actually does quite a lot of public engagement work. They are doing an incredible piece of work on citizens jury. So we've recruited over 600 members of the public in Yorkshire and Humber to actually feedback on the work that we're doing. So if you see kind of adverts or there are patient groups and that you can join via your GP practices and things like that to actually feed into some of the work that we're doing.
Amazing. Amazing. Kate, thanks so much for being here.
Thank you.
Huge thanks to Kate for bringing such enthusiasm to our conversation about health data security. Here's what I've taken from our discussion. NHS data is carefully processed to remove anything identifiable and then stored in virtual secure data environments. Researchers can then access the specific parts of this data for research under the 5 Safes framework, which ensures the security of this data. Kate and her team are constantly working to stay one step ahead of any potential mistakes that researchers might make that could pose a risk to the security of the data. To me, what really came across is the passion that Kate has about her work and the difference that health data research can make. Links to find out more about Yorkshire and Humber secure data environments and Data Connect that Kate described are in the notes. And huge thanks for listening.